Hello everyone. In today's class, we'll be identifying all organs of the abdomen and pelvis, and we'll try to identify the basic parts of each of the organ and also site determination in case of kidneys, testis. Okay. So let's start with this first organ. This is the largest organ in the abdomen. Which organ is this? This is the liver. Okay. So liver, how to hold it in anatomical position. This is the region of inferior vena cava. If you have a plain forceps, you can just put the forceps inside the inferior vena cava and hold it straight. Okay, that's how the liver is held in anatomical position. You all are looking it from the top. Okay, we can see this one is the inferior vena cava. Okay, so when I'm holding the liver in anatomical position, this is the right lobe of the liver, this is the left lobe of the liver. Okay, and in between the two lobes there is one ligament that's referred to as the falciform ligament. It is not very clear here, but it is in this region. We can see the falciform ligament. It extends behind and it continues as the left triangular ligament on the left side, and on the right side it continues as a ligament called as the superior layer of the coronary ligament. Okay, and there is one inferior layer of coronary ligament in this region, between which there is an area called as bare area of the liver, and both layers of coronary ligament then they unite here in this region. That's referred to as the right triangular ligament. Okay, so these ligaments are nothing but the folds of peritoneum which are there. Okay, and this falciform ligament lower margin has got this thickening here. This is referred to as the ligamentum teres hepatis. Ligamentum teres hepatis, it's a remnant of the left umbilical vein. Okay, then when we see on this side, this surface is referred to as the visceral surface of the liver, and this large convex surface referred to as the diaphragmatic surface of the liver. Okay, so visceral surface basically is related with the visceral organs, and there is one important part. This is referred to as the caudate lobe of the liver. Okay, this is the caudate lobe of the liver, and there is one lobe here that's referred to as the quadrate lobe of the liver. Okay, it's a part of right lobe. We can see quadrangular part. This is the quadrate lobe and this is the caudate lobe. Okay, and since this is a visceral surface, which organs are related here? There is relation of the esophagus, then there is stomach, then the pyloric part of the stomach, then the first part of duodenum is there. First part of duodenum is in this area, and this is the gallbladder, and there is the right kidney which is related. Okay, and the diaphragmatic surface related with the diaphragm, and on the right side this is referred to as the right lateral surface of the liver. This also has got relations. There is upper 1/3, middle 1/3, and lower 1/3. Okay, there is upper 1/3 part is related with the lungs, the pleura, as well as the diaphragm. Okay, the middle 1/3 is related with only the pleura and the diaphragm. In the lower 1/3 it is only the diaphragm. Okay, so there is different set of relations in upper third, middle third, and the lower third of the right lateral surface. Okay, so liver is a very important organ that is asked in the anatomy viva that you need to identify. Then let's identify next organ. Which organ is this? This organ is the stomach. Okay, so how to hold the stomach in anatomical position? So you have to hold it on your left palm like this. Okay, so you have to see this is the cardiac end of the stomach, this is the pyloric end of the stomach. Then there are curvatures. This curvature is referred to as the lesser curvature of the stomach. This curvature is the greater curvature of the stomach. Okay, then the different parts. There is the fundus, there is body, there is the pyloric part of the stomach. Okay, in the pylorus we can see a thick muscle wall that is felt here. Okay, when we cut open the stomach from the greater curvature, we can see the interior of the stomach where we can see multiple rugae. Okay, these folds are referred to as rugae, gastric rugae, and then there are pits referred to as gastric pits. And in the region of lesser curvature, okay, lesser curvature, when we see from the inner aspect, this part is referred to as the gastric canal. Okay, gastric canal of Megenstresse. Okay, then additional questions that you need to know are the peritoneal relations of the stomach, the blood supply of the stomach that can be asked. Okay, on the lesser curvature is the lesser omentum, and on the greater curvature the peritoneal relation is of the greater omentum, and there is one part of peritoneum from the stomach to the spleen is referred to as gastrosplenic ligament. From the stomach to the diaphragm is referred to as gastrophrenic ligament. Okay, this was about the stomach. Let's identify the next organ. Yes, which organ is this? You can see it's a fleshy organ. This is pancreas and this is the duodenum. Okay. So how to hold it in anatomical position? You have to hold it in a way that pancreas comes on the left side. Okay. And this duodenum, there's a C-shaped duodenum, and inside which there is this head of the pancreas. Okay, head, body. So there is this head, neck, body, and tail of the pancreas. Okay. So specimen of pancreas is usually along with the duodenum. Make sure you identify both of them. So when you name the specimen, say there is a specimen of duodenum and the pancreas. And duodenum has been cut open from this border, lateral border. We can see the interior of the duodenum. In the interior of the duodenum, one opening is seen here. That's referred to as the major duodenal papilla. Okay, major duodenal papilla opening is seen. Minor duodenal papilla is very small, that is not seen. And we can see multiple folds here. Okay, so these are the mucosal folds of the small intestine called as plicae circularis. Okay, then let's identify the next organ. So after duodenum is the remaining part of the small intestine, that is jejunum and ileum. Okay, so this is a specimen of small intestine, specifically the jejunum and the ileum. So how to differentiate it from the large intestine? So the most characteristic differentiating feature is this. We can see this yellow colored part, that's the mesentery. Okay, and this specimen is of the large intestine, which is not having that mesentery. That's how we identify this is small intestine and this one is this large intestine. Okay, so and large intestine has got some cardinal features which are not there in small intestine. Which are they? The wall of the large intestine has got a longitudinal bands. Those are referred to as tinea coli. Okay, tinea coli is seen. Then there are fat-filled pouches. Those are referred to as appendices epiploicae. Okay, appendices epiploicae, and the folds in the wall of the large intestine, those are referred to as saculations or hostrations. Okay, so these three features are referred to as cardinal features of large intestine. I'll repeat them: tinea coli, appendices epiploicae, and saculations. These are the cardinal features of large intestine. Okay, and in small intestine, you can try to differentiate which part is jejunum, which part is ileum. Okay, so for that, first identify the two ends. Okay, so I can see this is one end and this is the other end. So on one side I'll keep the jejunum and on the other side I'll keep the ileum. So on one side the wall would be thick, other side the wall would be thin. This thick side is jejunum, this thin side is ileum. And look at the lumen part. The lumen of the jejunum is more wider as compared to that of the ileum. Okay, this end is ileum. And you may look at the mesentery. Okay, mesentery has got some characteristic features. When we see it against the light, there will be more number of arcades that would be seen in the ileum. Okay, and in jejunum, the long vasa recta would be seen. Okay, so long vasa recta are seen in jejunum with very few arcades. Okay, in this it is not very clear because of excess deposition of fat, but this is one differentiating point that you can use for identifying which part is jejunum and which part is ileum. Okay, so we have seen this small intestine as well as large intestine. Which other organs are left in the abdomen? Yes, let's try to identify this organ. Which organ is this? This is spleen. Okay, so how to hold the spleen in anatomical position? You have to hold it in the left hand like this on your palm. Thumb should be on the superior border. Okay, hold it like this on your left hand. Okay, because spleen is present on the left side. And identify the different surfaces. This surface is referred to as the diaphragmatic surface. This surface is the visceral surface of the spleen. And we can see this is the superior border of the spleen. This is the inferior border. This is the intermediate border. Okay, how do we know it is intermediate border? If we trace this superior border, it will be continuous with this intermediate border. Okay, and there is this large concave impression that is seen here, this area is for the stomach. Okay, stomach is related in this region. In this region, the left kidney is related. Okay, the anterior surface of left kidney. Then on this region, the splenic flexure of the colon is related, and in the hilum of the spleen, the tail of the pancreas is related. Okay, so multiple relations you should know. And also spleen has got something called as Harris dictum. Okay, what is Harris dictum? It's a dictum of odd numbers. Spleen is 1 inches in thickness, 3 inches in breadth, 5 inches in length, weight is 7 ounces, and 9 to 11 is ribs. It lies between 9 to 11 ribs. Okay, so this is identification of spleen, and the ligaments related to the spleen are the gastrosplenic ligament, linorenal ligament, and phrenicocholic ligament. Okay, phrenicocholic ligament is not directly attached to the spleen, but it just supports the spleen on the anterior aspect. Okay, so this was spleen. Let's identify the next organ. Yes, which organ is this? So it's the kidney. Okay, so once you have identified the kidney, you have to identify the side of the kidney. It's of which side, right side or left side? So this kidney, I can see this kidney is of the right side. How can I say it is of the right side? Because I'm looking at the structures at the hilum, anterior to posterior. The posterior most structure should be the renal pelvis, which continues as the ureter. Okay, so this is one identification point. Anterior to posterior dimension I've covered here. Then medial lateral, if we see the hilum of the kidney is on the medial aspect. Okay, this is the hilum on the medial aspect, and for superior inferior, I'll look at this ureter, and it should be smoothly going downwards without any kink. Okay, if I try to hold it like this, the ureter bends down. Okay, can you see this bending of this ureter? That's referred to as the kinking of the ureter. Okay, kinking of the ureter should not happen. So that's why this kidney is of the right side. Okay, anterior to posterior structures in the hilum are renal vein, renal artery, and renal pelvis. Okay, posterior most we can see the pelvis, and the vein and artery are present here. Okay, and in kidney you should know the various relations of the anterior surface, posterior surface of both the kidneys. So right kidney, anteriorly which structures would be related? There is the duodenum. Second part of the duodenum is related. Then liver is related, suprarenal gland is related, coils of jejunum, then the large intestine, colon is related. Okay, so supposing if this is the left kidney, which organs would be related on the left kidney? On the left kidney, the left suprarenal gland, stomach, spleen, pancreas, jejunum, and the again colon is related. Okay, so some organs would be common on the left and right side, and some would be specific. And what about the posterior relations of the kidney? So posterior relations of the kidney, 3 muscles are there from medial to lateral: psoas major, quadratus lumborum, transversus abdominis, and there is one muscle from above that's referred to as the diaphragm. Okay, so diaphragm and the 3 muscles. Then there are vessels and nerves, subcostal vessels and nerve, iliohypogastric nerve, ilioinguinal nerve. Okay, those structures are there. Then there are arcuate ligaments, medial and lateral arcuate ligaments of the diaphragm. Okay, so all these structures are related on the posterior aspect, and the right kidney is related with 12th rib, and the left kidney is related with 11th and the 12th rib. Okay, because left kidney is slightly at a higher level as compared to that of right kidney. Okay, so we have identified kidney. Then yes, which organ is this? Many a time students find difficulty identifying this organ. Yes, we can see it's a muscular bag-like structure. Inside we can see some smooth area, and there could be some mucosal folds as well. And on one part I can see a firm structure. This is the prostate gland and the urinary bladder. Okay, so this large bag, that's the urinary bladder with the prostate. Okay, so identification of urinary bladder is important, and to hold the urinary bladder in anatomical position, you have to hold it in a way that the superior surface of the urinary bladder comes up, posterior surface goes behind. Okay, I'll try to hold it now. So you have to hold it in a way that both your thumbs come on the superior surface, your 4 fingers go on the inferolateral surface. Okay, And on the posterior part, we can see this seminal vesicle and the ductus deferens. Okay, so this lateral one is seminal vesicle, the medial one is ductus deferens. Okay, then we can see the superior surface would be slightly shiny because of the peritoneum which is covering on the superior surface. The inferolateral surface won't be shiny because peritoneum is not covering there. Okay, and on the inner aspect, there is one area called as the trigone of urinary bladder. Okay, if I'm holding it like this, just try to appreciate the three openings. One large opening everyone could see, this is the opening of the urethra, and try to appreciate these two small openings which are there here. Okay, these two small openings are of the ureter. Okay, so when I can draw a triangle here, so that triangular area is referred to as trigone of urinary bladder. Okay, in normal urinary bladder, this triangular area is completely smooth. Okay, because of frequent handling in this urinary bladder, the remaining areas also become smooth. Okay, but normally anatomically only this triangular trigone is smooth. Okay, so this was urinary bladder, and these are the ureters which are coming and opening in the urinary bladder. Okay, on each side, ureters. And you may be asked whether it is a male urinary bladder or a female urinary bladder. Okay, so if you have identified the prostate, seminal vesicle, ductus deferens, that means it is definitely a male urinary bladder. In female urinary bladder, these associated structures won't be there. Okay, and usually female urinary bladder specimen is there along with uterus. With that also you can identify. Okay, so this was the urinary bladder, and let's identify the organs of the reproductive system now. So in male reproductive system, which organ is this? This is the testis. Okay, so testis is present one on each side. So you're supposed to identify the side of the testis. So this testis, I'm holding it in the right hand. This is the testis of the right side. How did I identify it is of the right side? Let's see. So again, side determination points for superior, inferior, I'll say the epididymis is on the superior aspect. Okay. For anterior, posterior also, I'll again say the epididymis is on the posterior aspect. And for medial and lateral, I'll see this space here. Okay. This space here is referred to as the sinus of epididymis. Okay. Sinus of epididymis faces laterally. Okay. So this is the testis of the right side. Okay. And you may be asked about the coverings of the testis. The outermost layer is vaginalis, then there is tunica albuginea, then there is tunica vasculosa. Okay, so this is of testis. Then let's identify this organ. Okay, many times students are not able to identify this organ. Which organ is this? This is uterus along with the fallopian tubes and the ovaries. Okay, so along with uterus, few associated structures are also there. So uterus, fallopian tubes, ovaries, and uterus, there is a covering of peritoneum that is referred to as broad ligament. Okay, on each side we can see this transparent structure which is there. Okay, this part, this is the broad ligament which is there, and broad ligament has got different parts with respect to the relations. The part in relation with the body of the uterus is referred to as mesometrium. Then relation with the fallopian tube, there is mesosalpinx. In relation with the ovary, there is mesoovarium. Okay, when you're holding the specimen of uterus, make sure you keep the ovaries on the posterior aspect, and you can hold it at this ends like this. Okay, different parts of uterus are, upper part is the fundus, then there is the body, then there is cervix of the uterus. Okay, and there are a few ligaments associated here. From the ovary to the uterus is ovarian ligament, and in front of this fallopian tube there is a ligament called as the round ligament of the uterus. Okay, so in uterus there is an important question called as supports of the uterus. Read about it, which surrounding structures help to keep the uterus in its stable position. Okay, see, this is one more specimen having both kidneys, ureter, urinary bladder, as well as uterus. Okay, so a huge specimen. Okay, so here if this is urinary bladder with uterus, so this is a female urinary bladder with the uterus. Okay, and the fallopian tubes on each side and the broad ligament. Okay, and these are the ovaries. Okay, these are the ovaries on each side. Okay, and what is this opening here? This is the opening of the cervix. This opening is referred to as external os. Okay, cervix has got opening called as external os, and on the inner aspect towards the uterine cavity is the internal os. Okay. Okay, so we have identified all organs which are there in the abdomen and pelvis tray, its important parts and features, some important relations, as well as the site determination of kidney and the testis. Okay, I'll stop here. Thank you.